Okay, well, good afternoon, everyone, and congratulations, and thank you for persisting through the closing plenary and being here after 2 long days of intensive discussions and sessions and presentations. So we have been discussing since Thursday theoretical and conceptual frameworks, models, methodologies, empirics of how to integrate gender into macroeconomic analysis. What I will try to do in my talk today is situate within that broader context and address how we can engender now, as the topic of this session is on policy, moving on from theory, models, and empirics and methodologies, how we can engender macroeconomic policy and the crucial role that access to care and also access to decent jobs have to play in this context. Employment creation, decent employment creation has to play in this context. The motivation for engendering macroeconomics, we've based it on 2 broad premises, that macroeconomic structures, changes, and policies determine gendered outcomes. In return, gendered economic structures, changes, and policies have an impact on macroeconomic outcomes. This mutual relationship is deeply mediated through the gender division of care work, as we've been discussing during the past 2 days. Hence, one of the important contributions of a gender-aware approach to macro-analysis is to identify time as an economic resource and expanding distributional concerns to go beyond income to also include time distribution. Over time, feminist macroeconomics has evolved from focusing on unpaid care as a constraint on women's time and labor force participation to framing it as a foundation for human well-being and as an essential objective of macroeconomic policy in and of itself. This has led to a new focus of feminist macroeconomics on how care deficits and policies also influence macroeconomic outcomes or are influenced by macroeconomic policies. Thus, fiscal policy and public investment in what emerging feminist literature has been calling, led by Valeria Ekuvel here, has been calling transformative care systems, emerge as a central tenet of the feminist macroeconomic policy agenda. In my talk, I will first discuss this key policy pillar, focusing on evidence from applied policy simulations that I and several colleagues who are participants at this conference, and some of them have to leave, but some of them are still in this room. The applied simulation work on investing in care will be a focus of this presentation. Then I will turn to what I call the synergies or complementarities between feminist macroeconomics and other policy agendas, namely heterodox macroeconomics, economics of full employment and equitable growth, ecological economics, implications for the future of work under AI and digitalization, and finally the political implications for democratic erosion and resilience, a topic that İzaskun Zuazu picked up at the end of her presentation yesterday. So I will try to elaborate on that a bit further, building on what İzaskun has already said. And I will close by revisiting the question, what defines a feminist macroeconomic policy agenda? So let me first begin by clarifying what this emerging feminist terminology is, transformative care systems. So I would like to first set that as the basis for our discussions, because too often policy debates frame the question of investing in care or care services very narrowly. For example, expanding childcare for mothers in employment or addressing elder care in aging societies, which I sometimes call the World Bank approach, also making the whole framing conditional on women's employment status or labor force participation. But the feminist framing now adopts a comprehensive systems approach. The UN Secretary General's 2024 policy guidance white paper on the care economy, defines a transformative care system as a coordinated set of services, regulations, programs, policies, and infrastructure, macro-level infrastructure that consists of all of these, that aim to ensure access to quality care across the life cycle by restructuring how care is provided and valued. It aims to make care more inclusive, affordable, sustainable, and gender equitable, supporting both caregivers, care providers, but also care receivers. So this approach implies interventions, policy interventions across several dimensions, such as universal access to quality care services, time-saving physical infrastructure in contexts of less developed rural and urban areas, labor market regulation for work-life balance and decent care jobs, and policy coordination across macro-sectoral and legislative frameworks. My focus today will be on universal access to quality care services, and in the ILO's seminal 2018 report, Care Work and Care Jobs for the Future of Work, which again, Valeria was one of the leading authors, the framing of care services was formally defined and taken beyond the narrow focus on early childhood care and preschool education and long-term care to also include education, primary and secondary education, care of children of school age and youth, healthcare, and social services. So in countries with comprehensive care systems, employment in these sectors can reach over 30% of total employment compared to a global average of only around 11%. So there is tremendous scope there for expansion of paid care employment through public investments. In a simulation that we conducted using data from 45 middle and high-income countries representing around 85% of global population, we estimated that maintaining current care coverage to 2030 would require about 14.9% of GDP, which is what we call the status quo scenario, driven by population growth and demographic changes, while achieving universal coverage under what we call the high road scenario, which was defined in line with multiple sustainable development goals, indicators derived on the basis of the SDGs. This would require 18.4% of GDP, so an additional spending equivalent to 3.5 percentage points percent of GDP. So given the substantial investment needs, policy advocacy in this area faces predictable resistance from policymakers. The most common argument is, source of resistance is limited fiscal space. And I know this is what Karen's presentation after me will focus on, one of the issues that she will focus on, that care is not a spending priority in view of competing demands on public budgets. It's also been known that in context of high unemployment, policymakers, sometimes openly, sometimes behind closed doors, have been known to suggest that freeing women from unpaid care work could worsen job competition and worsen the unemployment problem. Also, increasingly, what we've been encountering is conservative narratives about gender roles reinforced by pronatalist policies. A further objection or ambivalence is based on something that also came up in discussions at this conference, that care sectors are low productivity and therefore offer limited potential for sustained growth. So in response, feminist economists have reframed care, not particularly in response to the resistance on the basis of limited fiscal space, reframed care not as consumption expenditures, but as investment with returns as social infrastructure. On that front, conceptual contributions by Diane Elson and Sue Himmelwhite, I think I saw Sue, I'm not sure where Diane is, yeah, they're also here, and the UK Women's Budget Group, of which they're founders, have been crucial in developing this framework. The argument here is that care expenditures, like physical infrastructure, yield returns into the future, economic returns. So this shift opened up a new analytical space for feminist macroeconomic policy, exploring what we call, beyond the well-known social returns to care investments, exploring also the economic returns to investing in care. Building on some of the discussion by Diane, Özlem, Elisa, particularly Özlem, because she talked about this on the basis of their findings through in a number of different country contexts in the opening plenary. I would like to emphasize that here that we can think of returns to care investments on both the supply and the demand sides. On the supply side, access to care services alleviates time and mobility constraints for caregivers who are predominantly women, increasing the probability of their labor force participation, but also possibly the probability of their participation in education, in public sphere activities. It also supports employed workers' work-life balance. Again, it is usually primarily women in employment who suffer from work-life balance issues and from time poverty. It helps to reduce time poverty with possible spillover effects onto enhancing productivity and also overall well-being. Access to quality care also improves human capabilities, particularly early childhood care and preschool education for small children, education services, healthcare are crucial inputs for enhancing human capabilities, again promoting productivity and supply side growth. The demand side, on the left-hand side, is often overlooked, well, until relatively recently has been overlooked, is an equally crucial mechanism for economic returns, and I will use that as for talking about the synergies between heterodox macroeconomic policy agenda and the feminist macroeconomic policy agenda. The outcomes on the demand side require a relatively shorter time horizon. It's through jobs generation. And that shorter time horizon, because as soon as the investments are made, jobs are created within a short time span, which then leads to decreasing unemployment, improving earnings, and decreasing income poverty. And this short time span does make a difference in terms of advocacy efforts in fiscal policy, which, as we know, operates within a short time frame of annual budgets, public budgets, and also elected political governments who want results to accrue within the election cycle. By contrast, the supply side outcomes on human capabilities and productivity effects, which are absolutely crucial, yet play themselves out over a longer time horizon. So on the demand side, the emphasis is the potential of care sectors for being a strong source of employment creation. This derives from their high employment multipliers, care work, especially direct care work, the person-to-person provisioning of care services is a labor-intensive work process and resistant to a large extent to automation. Public investment in care, therefore, creates a large numbers of jobs, both directly and indirectly, stimulating earnings, reducing poverty, and contributing to demand-led growth. And I should add that given that care sectors employ predominantly women, such demand-side effects also narrow gender gaps in employment and income through demand-side mechanisms, further reinforcing gender equality outcomes on the supply side. So policy simulations looking the first two set, so here you see that, and this is definitely not an exhaustive list. They are a list of examples. I've sort of sorted them out by their modeling approach to the policy simulation. So the earliest models developed by the Levy Economics Institute combine input-output modeling to capture direct and indirect employment creation at the aggregate level. Also use microsimulation models, and the masters are here in this room, Tam Masterson and Ajit Zacarias, that estimate how new jobs distribute by demographic and labor market characteristics of the observed population in a given country data set. The microsimulation also enables estimation of likely earnings of newly employed workers as a result of these care investments, what they would receive in wages, assess the impacts on income poverty, and if time use data is available and can be matched with household income data, it also becomes possible to assess the impact on time poverty. The macro input-output simulations have been used more widely for their flexibility, relative ease of application, and less limited data requirements. They estimate aggregate employment effects and gender composition of employment under different spending scenarios. Finally, what Özlem Onaran and Cem Oyvat call post-Keynesian structuralist feminists. There's Kaletsky somewhere in there also. Macro models go further by capturing both demand and supply side feedback loops. For example, as Özlem mentioned in her talk in the opening plenary, they show, for example, how redistribution of income to women through care investments on the demand side is mediated through gendered spending multipliers to enhance human capabilities development and overall productivity, creating a supply-side outcome. These simulation studies have informed policy advocacy across the globe, taken up by trade unions, ILO, UNDP, UN Women, even ministries of finance in some countries, such as Morocco, to make the application of similar, given this interest, in order to make the application of similar methodologies accessible in diverse country contexts, Jérôme Dehaenau, and unfortunately he had to leave, he couldn't stay for the plenary, and also I developed policy tools. I developed one for UN Women and ILO called Public Investments in Care Policy Tool, which Valeria was also involved in. At the time, in 2021, and Jérôme developed the ILO Care Policy Simulator in 2023. These tools are now being used by national stakeholders to assess care deficits in a number of sectors, subsectors of care services, the required level of public expenditures to eliminate those care deficits, and estimate potential economic returns on the demand side with a particular focus on job creation. Yes, so these are the tools. So the application of this framework across diverse countries and methodologies end up in some findings that converge strongly. Investing in care sectors is a powerful generator of new jobs, given both direct and indirect, given their high employment multipliers. Using Turkish data, for instance, we find that every unit of public expenditure on early childhood care and education sector creates about 2.5 to 3 times more jobs than equivalent spending by the government on construction and physical infrastructure projects. These new jobs translate into higher labor earnings, given that with more jobs, stronger poverty reduction, and improved income distribution compared with traditional infrastructure spending. Crucially, women, while both women and men benefit, women benefit more in the Turkish case. How am I doing with time? Oops, okay. For example, with Turkish data, we find that about 70% of the new jobs created via government spending on the childcare sector are to employ women, thereby narrowing gender and intersection inequalities in employment and earnings, but also there's substantial job creation, employment creation for men. These jobs also alleviate time poverty by redistributing unpaid care responsibilities, allowing more women to also enter into the labor force or remain attached to the labor market. And because care investment raises taxable incomes through substantial job creation, the studies commonly find that there are stronger fiscal returns effect and therefore self-financing potential. Here is a figure from the paper that Ki-Jong Kim and I did, the 45 country simulation that I had just mentioned, which was published as one of the chapters of the ILO Care Work and Care Jobs report. And this figure basically demonstrates that going from the 2015 baseline, even if the care services sector is to be kept at the same level of coverage with the same level of quality, it is still going to need to employ 152 million new workers into 2030. And if instead that additional 3.5% of GDP expenditures is undertaken, there is potential to create for another 117 million new jobs. And in this case, we found the gender composition, the share of jobs going to women overall, including direct and indirect, across education, healthcare, long-term care, to be around 55%. So moving on to my next point on the intersections of the policy agendas, the feminist macroeconomics of investing in care, which basically promotes this policy for gender equitable growth, and the heterodox macroeconomics policy agenda with a focus on full employment and equitable growth have an intersection here, have a built-in synergy. So the discussion moves from unpaid care work as a time constraint on labor supply and treating care as a public good to also looking at investing in expansion of paid care jobs as a booster of labor demand. But as we have seen, the magnitude and composition of fiscal spending matters for the magnitude of whether the government decides to put that fiscal allocation to physical infrastructure versus social infrastructure has concrete outcomes in terms of the level of jobs generation, its composition, and distributional outcomes. So here are some quotes from some leading economists on fiscal policy for macroeconomics for full employment. Stiglitz here reminds us that markets alone cannot create full employment on their own, especially amid global demand weakness. He argues for proactive industrial and fiscal policies that prioritize labor-intensive sectors, such as education and health, which are both central components of the care economy. Dani Rodrigues similarly emphasizes that the erosion of good, secure jobs is not only an economic problem, but a threat to social and political stability. And the work that Izaskun and I are involved together aims to put this outcome in a gender and macro framework. The UNCTAD Trade and Development Report from 2017, which Elisa was one of the authors, notes that the type of public spending matters, and spending on social services, in particular care activities, enjoy these high multiplier effects, employment multipliers. And the report also marks that employment challenges associated with structural and technological change AI and digitalization. And I think this was the first report that, that actually identified this context. Transforming care activities into decent work should become an integral part of strategies aimed at building more inclusive economies. And finally, a UN Secretary General report calling on all member states for 12 commitments brings up investing in care under 2 of these commitments. One of them is on gender equality. It calls on member states to invest in care sectors to facilitate women's economic inclusion. And also, it comes up under the under SDG 8, promoting growth through decent jobs, investment in sectors with the greatest potential for creating more and better jobs, such as the green, care, and digital economies. So that brings me to another synergy between the feminist macroeconomic policy agenda and the green economy agenda. I think Özlem did mention it in her plenary intervention, that purple jobs are also green jobs, because what we are talking about, to a large extent, because what we are talking about is local service jobs with low emissions and low waste, which therefore promote green transition. The call for a shorter working week, and I put in parentheses market working week, because we know the unpaid working week within the household goes on. So the call for a shorter market working week is an overlapping demand between the green and the purple economy policy agendas. And on the purple economy side, it also allows equitable, beyond low emissions, it allows for more equitable distribution of unpaid care work between women and men within the household. Both policy agendas present a response to crises. The green policy agenda is in response to the ecological crisis. The purple policy agenda is in response to the crisis of care, which feminist scholars have defined in different ways. And they both simultaneously propose a response to the economic crisis and joblessness under the motto of green and purple jobs for the future of work. And both policy agendas call for a beyond GDP framework, which is becoming increasingly important, and I think has gone a long way to become more operational in terms of macro indicators, calling for a caring and sustainable growth, including the possibility of degrowth as a component of macroeconomic policy agenda. In the case of the feminist literature, the various articulations of this has been caring economy, care society, purple economy, and caring democracy. Thorsten reminds me that I have only 1 minute left. So yes, so this part maybe can come up because I have 2 more slides on this. I'm thinking that maybe it can come up in the Q&A. And this is about the gender and macro interactions and political implications, sort of taking the context, also speaking to the context that Dani Rodrik is talking about. So as Izaskun mentioned yesterday, what we observe is political gender gaps in most of the advanced economies transforming from what is called the traditional political gender gap, where women place traditionally to the right of men in political preferences, towards modern gender gaps, where women start placing themselves politically, ideologically more to the left of men. Italy and Turkey, which is where I'm based, show persistent traditional gender political gaps despite substantial economic transformation. And what we find in the data is that this is determined by a very large share of women who identify themselves as in the full-time homemaking occupation. And therefore, this is the electoral base that populist leaders basically address. And the electoral data shows that the probability in the Turkish context, for instance, also in the Italian context, of women full-time homemakers giving support to populist authoritarian leaders is significantly, statistically significantly higher after controlling for all kinds of other determining variables. I interpret this as being in response to a conservative gender discourse by populist leaders celebrating women's roles as mothers and wives. So in fact, recognizing care work, unpaid care work, giving recognition and celebrating that, but telling women that they need to stay there in that, not even gender, in that role that is defined by their sex. And also, I argue that this returns into a vicious cycle as when authoritarian populist regimes come to power in order to appeal to this particular group of women, they start implementing economic and social policies such as cash transfers for care, pensions for homemakers, and a whole series of pronatalist policies. And the macroeconomic connections, basically, I built in the Turkish paper and also in the paper with İzaskun, appealing to a feminist theoretical framework, which we call the parallel systems approach, patriarchy and capitalism as parallel systems, where capitalist growth it's a historical materialist theory, where capitalist growth erodes patriarchy, where and when there is a need for women's labor supply for their absorption into the labor market, and capitalism, on the contrary, accommodates patriarchy, where when there is no such need, when under conditions of jobless growth, slack labor demand, not good enough export performance, as in the case of the Turkish economy, for instance, or as in the case of natural resource economies. I call Turkey the example of jobless growth or not sufficient jobs generating growth over a long sustained period of time vis-a-vis the population and rural to urban migration patterns, and leading to a large share of women homemakers amongst the electorate, leading to the situation that we've been in the past 20 years. Whereas Spain, as the opposite example, where upon joining the EU, what we observe is robust jobs-generating growth, a very rapid absorption of women into the labor market, and a reversal in economic and social policy and care regimes from being familial to socialized care regimes, and therefore creating what I call virtuous cycles. Thank you.